Hi guys, I'm Dr. Sunil Sharma. Today's topic is about Plummer-Vinson syndrome. Plummer-Vinson syndrome, or you can say syndrome, or you can say sideropenic dysphagia, or you can say post-critical wave syndrome. Okay, so this is Plummer-Vinson syndrome, Patterson-Kelly-Brown syndrome, or sideropenic dysphagia, or you can say post-critical syndrome. Before describing this, I want to tell you some history about it. In 1912, Plummer described it as cardiospasm. He described there is cardiospasm in upper esophagus without anatomical narrowing. After that, in 1915, his pupils described some narrowing. But in 1947, this disease described by Patterson and Kelly. They described it is triad. This is triad of iron deficiency anemia, post record web, and dysphagia. So, Plummer-Vinson syndrome, PV syndrome, or Patterson-Kelly syndrome, Brown syndrome. It is triad of iron deficiency anemia, post-critical web, and dysphagia. Okay, so this iron deficiency anemia, post-critical web, dysphagia called Plummer-Vinson syndrome. Why this happen in iron deficiency? It's more common in female than male. Ratio is about 86% to 14%. Female male ratio. Most commonly found in middle age woman after 30 years of age. It's common in 30 to 45 years of age, which having malnourishment leading to this iron deficiency. What happened in iron deficiency anemia? Iron deficiency. What is defined iron deficiency? If it is hemoglobin less than 13 in male or hemoglobin less than 12 in female, leading to iron deficiency. This iron deficiency leads hyposensitivity, hypomotility, and degeneration in the hypopharynx. In the hypopharynx, which lead to degenerative pharyngitis, maybe sometimes sore throat, which lead to web formation. So this is iron deficiency lead to hypersensitivity, hypomobility, degeneration in the hypopharynx, which ultimately lead to degenerative pharyngitis, web formation. Web may be formed anterior web just behind the postcricoid, or it may be circumferential. So wave may be formed in anterior web or circumferential. Second component is postcricoid web. Postcricoid web of this syndrome is maybe anterior type or circumferential type. Like this is the larynx, anterior larynx. So this web may be formed like this, anterior type, or this web may be in circumferential type. That this web can be diagnosed in like by barium swallow or by endoscopy. If patient come to you with dysphagia, you can do barium swallow or endoscopy. In middle-aged woman, you find this postcricoid with either anterior type or circumferential type. Now, third characteristic is dysphagia. Dysphagia that may be initially for solid, then leading to semi-solid, then ultimately for liquid oil. That is progressive in time. Progressive dysphagia. There is always progressive dysphagia, firstly solid, followed by semi-solid and liquid also. Atkinson et al. Graded it from 0, 1, 2, 3, 4 type. If it is no dysphagia, means normal. No dysphagia, normal. Unable to swallow some solids, then it's grade 1. Then grade 2 is able to swallow certain semi-solids. Atkinson divided it. Then able to swallow certain liquids and unable to swallow liquids. So Atkinson divided this dysphagia in Plummer-Vinson syndrome. Grade 0, normal swelling without any dysphagia. Grade 1 is unable to swallow some certain solids. Grade 2 is able to swallow certain semi-solids. Grade 3 able to swallow certain liquids and unable to swallow liquids. This is grading of dysphagia. Now, how to diagnose Plummer-Vinson syndrome? Diagnosis. Diagnosis is clinical plus lab plus endoscopy or barium swallow. If clinically you say middle age woman with iron deficiency, you can say ferritin level, serum ferritin level less than 30 or MCV value less than 80 also, or hemoglobin less than 12 in female or less than 13 in male. So this defines iron deficiency. Now endoscopy or barium swallow, you can find where post-clipboard web in upper esophagus, post-clipboard web formation upper esophagus. So this is diagnosis. DD maybe like cardiospasm, GRD or post-clipboard carcinoma. Now treatment. Treatment of Plummer-Vinson syndrome is treatment. First is dilatation with CRE balloon. CRE balloon. These are very good balloons which called controlled serial expansion balloon. This is the therapy of choice. CRE balloon, controlled serial expansion balloon. If you see esophagus, we put a guide wire with balloon catheter inside this. Here is the bag. Then we inflate it. So this balloon, all guide wire inflated. So this, according to size of the lumen, we are doing the serial balloon dilatation. You can divide also this luminal Plummer-Vinson syndrome into mild, moderate, and severe type. Suppose if lumen is narrowing, less than 1/2 of the lumen is narrow, then it is called mild Plummer-Vinson syndrome. If lumen is between 2/3, half and 2/3 lumen is narrowing, that is called moderate type of esophageal web or post-clipboard web. If lumen is more than 2/3 is narrowing, then it called severe PV syndrome, or you can say severe web formation. So on doing this dilatation with CRE balloon, and most of the patient relieve with single dilatation about 80%, or some may require repeated balloon dilatation in this Plummer-Vinson syndrome. Secondly, what initially we are doing is dilatation with esophageal boogies, or you can say boogie dilatation. We have rigid boogie and we are putting this boogie in multiple size. It's come in French from 20 to 40 French size. We are mostly doing with 32 French size boogie dilatation, that is more than sufficient, about 1.5 centimeter. Okay. Luminal expansion. So best method is dilatation with CRE balloon or dilatation with esophageal boogie with rigid esophagoscopy, or you have to give oral therapy or parenteral therapy, iron deficiency. You have to correct iron deficiency in folic acid. You have to give ferrous sulfate plus folic acid. So this is about for 3 months. You have to give therapy. This is about Patterson-Kelly-Brown syndrome or PV syndrome. Thank you so much.